So good evening, everybody. In commemoration of Prevention of Blindness Week, we are conducting this webinar on the topic disaster management with an inclusive lens. The importance of disaster management in ensuring safety and well-being of our communities is very crucial. However, it's equally important to approach disaster management with an inclusive lens, taking into account the needs of all the members of our communities, including those with any kind of physical impairment. We often overlook this, the need of inclusive disaster management that considers the need of all individuals, including those with any disabilities. So this webinar is organized by Sphere India Academy in collaboration with CBM India Trust. And it's an opportunity for all of us to come together to discuss the ways in which we can ensure that our disaster management efforts are inclusive and effective. We'll hear from experts in the field who will be sharing their experiences, perspectives, insights, and we'll also have an opportunity to ask questions and engage with meaningful discussions with them. So together we can work towards building more resilient communities that are better prepared to face disasters and emergencies, while also ensuring the needs of all the members of the communities are met. So I very proudly welcome all of you to this session, and I believe this is going to be a wonderful, insightful session for all of us. So without any further delay, I would like to hand it over to our moderator for the day for taking it over.
Thanks, Hannah, for coordinating, and thank you everyone for joining us today. Without further ado, let me introduce our panelists for today's session. So first we have with us Dr. Dominic Mesquith, advisor CBM India Trust. He is a community health professional with over 30 years of experience in the field of community medicine. Dr. Dominic is a retired professor and head of community medicine at St. John's Medical College. Dr. Dominic has an in-depth knowledge and expertise in training community health providers in community medicine at primary, secondary, and tertiary levels of healthcare. And he has also conducted evaluation of community-based health intervention programs at both national and international levels. At CBM India office, Dr. Dominic is advisor in community-based inclusive development and inclusive eye health. Welcome, Mr. Dominic. And next we have with us Ms. Namrata Mehta, Technical Specialist, Policy Analysis and Coordination, Sight Savers India. Ms. Namrata is a social work professional with over 14 years of work experience in program, grant, stakeholder management, and project monitoring. At present, she is working as Technical Specialist, Policy Analysis and Coordination at Sight Savers India. Prior to this, she was a program manager at Sight Savers India, working a project supported by the European Union on empowering rural organizations of people with disabilities towards localization of sustainable development goals and disability inclusion. She has also previously worked with Plan International and Access Development Services. Welcome, Ms. Namrata. And next we have with us Mr. Ravi Ranganathan, Director Programs, CBM India Trust. Mr. Ravi has 19 plus years of experience in the development sector in managing the program and operation across various INGOs, government, and the UNDP on the thematic areas of old age, disability, inclusive health, and with a focus on community eye health, rural livelihood, youth employment and livelihood, volunteer for development, sexual reproductive health rights, disaster risk reduction, and humanitarian assistance. Prior to CBM, Mr. Ravi has worked with Restless Development as the head of programs, managing field operations, and also in disaster risk reduction and humanitarian assistance programs. He has held several positions with UNDP and state governments on system development, DM plan preparation, training, and capacity building and mainstreaming DRR program. Welcome, Mr. Ravi. Finally, we have with us Ms. Kinnari Desai, Senior Manager Inclusion, Blind People's Association. She's a disability inclusion professional with over 10 years of experience and the recipient of numerous awards and fellowships, including the International Ford Foundation for Disability Studies. Ms. Kinnari has facilitated intergroup dialogues between development organizations and disability organizations, developed heterogeneous networks of organizations for the promotion of inclusive practices, and build the capacities of people with disabilities for increasing access to fundamental rights. Ms. Kinnary has also worked on various projects such as training 130 people with disabilities in theatre and forming 10 theatre groups that performed 328 street plays in 10 days in remote places of Gujarat, which is recognized as the world's largest theatre event for and by people with disabilities. She is actively involved in various committees and organizations to draft policies to implement the Rights of People with Disabilities Act in Gujarat. Her contribution to disaster management in Gujarat has been remarkable. Welcome, Ms. Kinnary, and welcome to all our panelists and all our participants. Without any further delay, we can begin this session. A note to our panelists that each of you have been allotted 10 minutes to ensure we have enough time for discussion towards the end. I request you all to please stick to this time limit. Meanwhile, participants can share their comments and questions in the chat box, and we'll address these during the discussion. First of all, I would like to hear from Ms. Kinnary. Okay, so Ms. Kinnary is not with us at the moment. So maybe I can move on to Dr. Dominic. Dr. Dominic, can you tell us how we can improve communication and collaboration among diverse stakeholders, including government agencies, civil society organizations, and affected communities to ensure that disaster management efforts are inclusive and effective?
Good evening, my co-panelists and the guests at this webinar. And I would start by trying to say how we can improve communication and collaboration to ensure that disaster management efforts are inclusive and effective. Next slide, Uma. When we look at disaster risks, disaster risks do not exist because of the presence of a physical hazard. They are compounded by the presence of vulnerability. The marginalized groups, gender, persons with disability are a lot more vulnerable when a disaster strikes. So they suffer disproportionately from these hazards. Next one. The focus of disaster management needs to change from hazard to vulnerability reduction, which means that we've got to plan before we plan for persons with disability, for vulnerable groups, to ensure that when a disaster, when there is a hazard, they are taken care of. It's got to move from reactive to proactive. It's not that a disaster strikes and then we respond. We've got to be able to proactively look at all the measures that have to be taken to ensure that there is limitation to what the disaster can do. It's got to move from a single agency trying to manage what's happening in a particular location to partnerships, to collaborations, to ensure that there is a lot more hands when a disaster strikes. It's got to move to it's got to move from response management to risk management. That means we don't respond after the disaster strikes. We look at managing the risk that happens when a disaster strikes. Next, please. What are the issues in risk management? There are significant gaps in preparedness on the various aspects of risk management. Departments of disaster management or relief and rehabilitation need to be strengthened in terms of preparedness. It's not response takes place, but they've got to be prepared to respond appropriately. Preparedness at various levels are not people-oriented. I mean, we may have different departments looking at disaster, and it's a question of what they can do, but it's not people-oriented. When you respond to a disaster, it's got to be more towards the people who are affected by it. And this plays a role in the this plays a role in disaster preparedness. Systems and facilities need to be strengthened. It's not that governments and private and public partnerships do not have systems in place for disaster management. They have systems. They require to be a lot more strengthened, because in a country like India, which has a large population, a vast area exposed to different kinds of disasters, all these departments require to be strengthened. A higher priority is being given to response. When a disaster strikes, with media coverage, with etc., current modern technology, priority is given to response. Reduction planning. So what do we mean by this? If I have to look at risk reduction, they are all locally specific.
Dr. Dominic, we cannot hear you at the moment.
I can't see your screen.
It is shared, sir.
Okay.
Dr. Dominic, you're not audible. Maybe there are some technical issues from your end.
Can you hear me now?
Yes, thank you. Yeah.
Yeah. Give me a minute. Hello?
Yes, sir.
Yeah. One of the key things in risk management is collaboration. And the process of collaboration between the authorities is often challenging due to various reasons. Difference of culture, processes and systems, different motivations, incentives and competition for limited resources, and a lack of coordination between agencies involved. Basically, when we talk of collaboration, it's a form of collective action and governance that brings together agencies to work across organizational boundaries to solve problems that cannot be effectively addressed by a single agency or organization. When a disaster strikes, no single agency can or government can handle everything. You require multiple inputs into it. So in essence, several organizations exert joint actions in favor of public interest to meet the needs of that disaster. Collaboration is not after a disaster takes place. Collaboration prior to a disaster and after a disaster is imperative to effectively manage the impact of disasters. And that's the key to risk management. Next, Uma. So if we have to look at the gaps and the key opportunities that are provided for us to look at how to make collaborations and communications inclusive so that people who are vulnerable are included, we look at what are the gaps that are there first. We have limited availability of the consolidated knowledge, resources, tools, and guidance from a point of view of a disaster. We have limited availability of analytics and standard data sources on disasters and on communities that are exposed to a particular disaster. We have limited access to disaggregated data and data collection methods in disaster-prone areas. So these gaps provide us with opportunities to advance the knowledge and learning agenda to develop global knowledge that will help us make available tools that will help us in disaster management or risk management. So what should we be looking at? The development of evidence-based analytical products and tools using participatory approaches, global trends, and evidence. Providing expertise and technical assistance to the task teams on inclusive disaster risk management. Both are required. When we look at availability of limited availability, it is provided technical assistance in building capacity to mainstream inclusive approaches across all sectors. Very often it's just looked at as a single sector. No, it's got to be inclusive across all sectors when disaster risk management is involved. Undertake training and knowledge sharing efforts to increase internal and external capacity for inclusive DRM. Consolidate and make available existing guidance, analytical products and tools to promote the integration of inclusive disaster risk management, including monitoring and evaluation activities. When we look at the third gap, it is we have to create partnerships advocating for inclusive approaches to disaster risk management. How do we do it? By identifying and promoting systematized.
Dominic,
yes.
Just a note that in view of time management, I request you to please wind up.
Sure. My last slide, Uma. In conclusion, we must acknowledge and discuss social exclusion issues in the context of DRM, understand the differential needs and experiences of excluded groups, mainstream social inclusion into the DRM legal and policy frameworks, develop knowledge and evidence base required for effective policy making and programming, strengthen the capacity of relevant authorities engaged in DRM activities, engage communities at every stage of DRM projects and decision-making processes, make them inclusive, leverage emerging technologies to explore opportunities for advancing the inclusion agenda in DRM, and join the cause to raise awareness of inclusive resilience. Thank you.
Thank you so much, Dr. Dominic. As you mentioned, collaboration across levels and agencies and organization is key to ensuring inclusive disaster risk management. And on this note, I would like to hear from Ms. Namrita. Can you please highlight some key policy and advocacy priorities for promoting inclusive disaster management for people with visual impairments? Have you come across any successful disaster management initiatives that could give us some important lessons?
Good afternoon, good evening, everyone. Thank you very much for having me here and CVM for discussion. To start with, I will just talk a bit about Sightsavers India. We are working in India since 1966, and we are primarily working in 8 states in the health, inclusive education of children with visual impairment and social inclusion. Now coming to the discussion for today, when disabilities, including those with visual impairment, are adversely impacted because their condition exposes them to various additional risks. Therefore, disability inclusive disaster risk reduction and management becomes imperative. There are international, regional, and national frameworks in this regard. Let's first look at the Sustainable Development Goals. So, development goals, SDGs explicitly mention disability. Goal 11 talks about and
I think we have lost Miss Namrita due to some technical difficulties. While she will rejoin, maybe we can move on to Mr. Ravi from CBM. What are some of the measures that a person with any physical impairment can take to be prepared for a disaster? And how can we ensure that these measures are accessible and inclusive? Mr. Ravi?
Hello.
Yeah.
I lost your connection. I'm just back. Sorry.
Sure, no problem, sir. I was asking if there are some measures that a person with any physical impairment can take to be prepared for a disaster, and how can we ensure that these measures are accessible and inclusive?
Thank you. And yeah, so before actually responding to that, actually, I wanted to give some background why the person with disability is so important. So before I go into that discussion, I really wanted to thank the SPEAR team for this organizing wonderful webinar, keeping the person with disability and inclusion in the disaster reduction program. So I think most of you are really suffered and faced a lot of challenges during the COVID. We are just recovered from the COVID impact. So imagine last couple of years, everyone faced the challenges. We were using hand sanitizer. We were using so many protective gears. Imagine a person with visual impairment. Someone who is using the braille, someone go to the various places and touch it and use the tactile floor or use any other lift, handrails or any other things. And suddenly you tell them that don't touch, and touching is not something good practice. Imagine the kind of challenges they would have gone through, the kind of issues they would have faced. So that's something I wanted to recall during the COVID. The person with disability, especially the visually impaired, faced a lot of challenges. This is something I have seen it and we have responded. I just thought of recalling that experience before I go. So coming to the disaster risk reduction. So, globally, it's estimated of 15% of the population having some form of disability. So why disability? Because the disability and vulnerability are very well interconnected. So the most vulnerable, the person with the disabilities are the most vulnerable, and they are the neglected in any form of any type of emergency and disasters. And if you look at the mortality and morbidity rates in any disasters, the person with the disabilities are more. So this is the background that why there is a need for inclusion in disasters reduction and disaster preparedness. So already the United Nations Conventions on the Rights of the Person with Disability, the UNCRPD Article 11, which is very well clearly tells, and it calls upon the state parties to take all necessary measures to ensure the protection and safety of the person with disability in emergency. In same line, we have a wonderful DM Act in 2005, which also indicates very clearly that participations of organizations of person with disability and other CBOs are very well legally guaranteed. So coming to, because this short time, about 7 to 8 minutes, I really don't want to go and talk about many other things, because the other panelists talk about the collaboration, the kind of other legal aspects, other policy related things. I wanted to limit my points only with the community level preparedness. See, you look at it currently, our warning systems, our rescue, shelter management, or any other distribution systems, data collections. These are the things which is very important, especially during the emergency response. So look at the current systems and current practice, how these are inclusive. See, for example, I wanted to give you some type of impairments. Many people having cross and multiple disability. With the current type of disabilities, more than 21 types of disabilities are there. I'm not going into that discussion. But what is most important is that the most important coming to disability, I would like to categorize 4 impairment. One is the visual impairment. Visual impairment is which includes blindness and low vision people, hearing impairment, intellectual impairment, physical impairment. The physical impairment is nothing but the locomotive disability. So consider this 4 type of category of disability, how our warnings and signals and other systems are there. Suppose you see visual impairment. The person can't see anything. But if you put all information, your digital communication, all your messages, because in emergency, we get a lot of WhatsApp messages. And are these messages are really accessible? Can the person with the visual impairment can read it? That's a big question mark. For example, like you have a PDF version coming in your computer or in your mobile phone, smartphone. The person with disability doesn't have access to read it. So that is the challenges remain. So when you are thinking of any warning systems or any warning information, we need to really think about the kind of different disability and make this information and communication which are accessible. So based on that, I would like to suggest, suppose your visual impairment, please have a mostly auditory signals, alarms, an announcement. It could be digital announcement or podcast, or it could be megaphone in the community or loudspeaker system. And somebody has a low vision, write with the large font characters and color contrast so that the person with low vision can read and understand. So visual impairment, considering the visual impairment, you need to really make your early warning systems are appropriate and to person with visual impairment and blindness. The other way, coming to hearing impairment, one can see it but can't hear it. So like we have today, I think this session we have a sign language interpretation. I'm not sure it is working today. The hearing impairment is concerned. The people can't hear you, but they are good in visual signages. They can see various symbols, pictures. And but what is the problem? Suppose you give a siren, the person can't hear, whether it's an ambulance siren or any other announcements, they cannot really hear. So keeping the hearing impairment, our preparedness is something like we should have a more visual signages, more pictorial signages for the early warning. Coming to intellectual impairment, it is really challenging, and it is not many people who are trained and respond to the group of intellectual impairment. So we need to have a special signages, many symbols, clear and brief announcement, So it is not something you do very fast and then you are just having unclear communication. You need to really have a very clear, very short and simple communication. So similarly, for the locomotive disability, you can have auditory signals, alarms, and announcements and everything. So what is most important, that the early warning systems, which is playing crucial role to reduce the loss of life and resources and materials, we need to have inclusive early warning systems, keeping the impairment in mind. The next aspects, which is very important, the most important one is the institutionalization at the community level. I especially, when I was with UNDP, I did a lot of trainings, village plan preparation, various formation of groups, disaster management committees, task forces, disaster management team. Many things we did it, and then respective government were doing it in Gram Panchayats level, village level, DM plan preparation, etc. But what is the question is that, are these committees inclusive of person with a disability, which is very important. So if suppose you have a early warning committee, please try to include the person with a disability in that group. So their challenges, their issues are well addressed, and they can give you better solution, making a appropriate early warning system, inclusive warning system. Similarly, for all task forces, starting from search and rescue, first aid, shelter management, damage assessment, psychosocial care and support, any task forces which are very important task force during the response phase. So please keep the person with the disability part of this task forces. Imagine like the shelter. It could be like your cyclone shelters or multi-purpose hall or flood shelters, whatever the shelter. Are these shelters are accessible? What happened to the person who's using the wheelchair user? Can the person access to the cyclone shelter? It's highly elevated and only having the options of staircase and no ramps and no rail. Imagine the conditions. Like I said, the 15% of percentage of the population having some form of disability. So accessibility is very important, especially the physical accessibility. There is need for a ramp, rail provision. Are these toilet are really accessible? Is there a grab bar in the toilet? All the taps, all the other fitments in the toilets, are they accessible? Are they needs for people to assist? We need to really ensure that the shelters, the cyclone shelter, the flood shelter, or any other multi-purpose shelters should have the accessible features. We need to create accessible features in the shelter. Coming to damage assessment. The damage assessment, like we go and do a lot of data. Are these data having disability disaggregated data? Very often we don't have, especially when we do the CITRIP data or the first level data, which is published in the newspaper, in the website. If you look at it, there will be a lot of information, general information will be there. But you see how many, the most vulnerable, the most neglected community, how many person with disabilities are affected, the data is missing. So even much later also, this particular data is really missing. Even you go there at the community level, during the preparedness phase also, actually the database is not well documented. Like the DM plan is prepared, there may be a village map, a social map, where you can color code the person with disability houses. And in the database, you can see how many person with disability, what type of disability. If the data which is already there, it's easy for you to take it and respond. It helps you to timely and quickly evacuation and response to the most needy community. Rather than just going and screening the entire community, where is the most vulnerable is there. So this helps people are evacuated safely and they are having a safe shelter in their accessible shelters. So we need to really have a disaggregated data not just at the time of response, even before the preparedness. Like you see, other aspects like the livelihood. First is our responsibility is to reduce the loss of life. The second one is reduce the loss of livelihood. So when it comes to livelihood, the person with disability are further vulnerable in terms of livelihood. If you look at the resilience, their resilience level is very poor as compared to our person without disability. So the person with disability, they have some livelihood option. It could be a petty shop, or it could be tailoring unit, or they may be part of doing some supplementary kind of complementary livelihoods or any other income generation program. It is very important to really have a resilience plans for the person with a disability and train them, give them adequate skills so that when the emergency comes, their loss is reduced, and otherwise the impact is very high on the person with disability. So it's very important to involve them at the stage in the resilience aspects as well. And how do we know the community's resilience is increased, the capacity is increased? When we do mock drill or when we do tabletop exercise. So please involve the person with the disability at the time of mock drills. And during the training and capacity building, involve them, and the person with disability actively participates. And they are the experts, they can tell what they want. So include them in the training and capacity building. Another is proposal, or when the designing of the emergency response. So we really need to include right from the needs assessment, right from the situation assessment, not at the time of responding or distributing materials, food and non-food. Because when the needs assessment time only, the actual needs of the person will very clearly come out from this group of person with a disability or the organizations of person with a disability. So we need to collect that information with the help of active participations of person with a disability, which includes project designing, implementation, and evaluation also. So what happened, because of disasters, some people become disabled. The impairment could be visual impairment, it could be locomotive disability, or any other hearing impairment due to disasters. So what happened, we need to really have in our emergency response package, there should be a provision for assistive devices. People might need a wheelchair, people might need walking sticks, they need a hearing impairment, they need their eyes are checked, and any issues, they need to be treated, appropriate spectacles and other assistive devices should be given. So we need to involve them in the entire process. And most importantly, the monitoring and evaluation, people can really monitor the actual needs of the person with disabilities really met. And you can look at the various humanitarian charter and other guiding principles, and really applied well. And it will help you as a humanitarian agency, helps you that you really did the inclusive humanitarian or preparedness, and what is the area to be improved. So you can really do a lot of evaluation involving the person with the disability. And it is also very important, like you also work with other like-minded agency, because it is not something you alone can do. For example, in CVM, we cannot do a larger humanitarian response based on our capacity, our financial resources. But what is most important, that like we meet many people and talk to people, sensitize and bring the culture of mainstreaming inclusion in disaster risk reduction. It's most important. So we need to really sensitize and train other partners. See, everybody is doing humanitarian response. Bigger players, national player, international player, local IAG, district level NGO coordination team. Are these people really having adequate information on disabilities? So we need to sensitize and train them. So most importantly, we have to ensure the person with disabilities participation. and involve the person with the disability in all the process of disaster risk reduction, disaster management, and disaster preparedness. And as much as possible, an easy way to bring the inclusion is bring the OPDs, organizations of person with a disability. It was called DPO also, and their representatives also. And we need to always think the diverse needs and capacity of the person with the disabilities are incorporated in the emergency response in the various task forces. And
thank you.
Yeah, is the time off?
Yeah.
All right.
Thank you, Mr. Ravi, for highlighting some key action points that we need to take to ensure inclusive disaster preparedness as well as disaster risk management. We have Ms. Namrata back with us. Maybe on this note, Ms. Namrata, you could tell us a bit about successful inclusive disaster management initiatives that could also provide us with some key lessons.
Sure. Can you hear me okay? I'm so sorry. The internet went off at that time.
Yes, Ms. Namrata.
So I think a lot has been covered by Mr. Ravi. But what I would like to say that there are factors like accessibility, which there are factors which need to be taken into consideration when we think of the three phases of disaster preparedness, during the disasters and post-disaster. So firstly, when we talk about accessibility, it is important that people with disabilities, those with visual impairment, have information in accessible formats. Also, the evacuation routes and the shelter homes needs to be accessible. We all remember those 20-second videos during the COVID time when somebody was singing the birthday song and they were showing that how to, the hand washing technique to prevent yourself from the COVID infection. Like a person who's visually impaired like me couldn't know what was the hand washing technique until those audio descriptions and narratives were added to those videos. They became useful for a person with visual impairment. We have already heard about including people with disabilities in the planning and decision-making processes during the disaster management processes. Basically, this is important because their experiences and requirements will help in effective strategies. Of first responders, officials, and volunteers is must. They could be trained for how to communicate with people with visual impairment, how to assist them. So I think you might remember that 2 weeks back there was an earthquake around Delhi, and that time I was traveling back in a train. I was on my own and I was about to reach Delhi. The earthquake happened and the train stopped. I started wondering, what if there is an evacuation? Will the people know how to assist me? And that's how, these things become very critical. One very essential thing is that data collection of on disability, so that policies could be formulated and resources could be allocated when a disaster situation arises. It is also very critical to take into consideration the intersectionality among people with disabilities. For example, older people, women, children, and those with multiple disabilities. For example, if a person who cannot see and cannot hear, the person with deaf blindness will have different requirements. Here I would like to share an initiative that Sightsavers took during the time of the COVID pandemic. So at the time when there was the vaccination drive going on throughout the country, people with disabilities, especially those residing in rural areas, were facing several challenges. Firstly, they did not have appropriate information, and because of this, there was a lot of hesitancy amongst them. Like, they wondered that whether this will increase their disability or this might not be useful for them, it might harm them or something like that. There was lack of accessible awareness material. Many were also finding it difficult to reach to the vaccination centers. So we started by developing accessible IC material, which was simple and in local languages. And we started disseminating them through online or whichever means it was possible. We also engaged with government authorities where we wrote letters to them and had meetings with them to prioritize people with disabilities and support them in vaccination. We mobilized and trained the members of our organizations of people with disabilities and the self-help groups we work with. They ensure that people with disabilities get vaccinated and they go to the centers, and the center, the people at the center take care of them well. In some places, some remote locations like tribal locations, and transport from and the centers. And in some places, we also tried to facilitate and work a way to vaccinate people with severe disabilities at their homes. So basically, in this initiative, the support of the government and with the help of around 150 volunteers, we could vaccinate around 10,000 people with disabilities. I think that's it. Thank you.
Ms. Namrata, are you still connected?
Can you hear me?
Your voice is breaking slightly, but you are audible.
Yeah, so these were some of the initiatives, and with the help of the government and with the help of 150 volunteers that we mobilized, we were able to vaccinate around 10,000 people across our project, for people with disabilities across our project locations. So I think that's it from me. Thank you.
Thank you, Ms. Namrata, for highlighting how crucial it is to train and prepare for disaster response and inclusive disaster preparedness. Maybe we have some time for discussion. So if the participants have any specific queries that you would like to address to our panelists, please raise your hand and you can unmute yourself and ask the questions, or share them on the chat and we'll take it up. Ms. Shruti Lata has, Afrosa, please go ahead and you can unmute yourself and ask your question.
Maybe are you able to unmute?
We see some comments by Mr. Navdeep Singh. Maybe you would like to share it with the group, sir. Ms. Shruti Lata in the chat has said that Give me a moment. Yeah, so Miss Shrutilata has explained that she has both visual and hearing impairment, and she would like to add that sign language is not standard and varies from person to person. And some people also rely on picture communication that is easy to understand, and all modes of communication should be considered, not just the case of visual impairment and hearing impairment. Would any of the panelists like to comment further on this?
Yeah, I request Dr. Dominic is very technical person who can give really good, but I completely agree with her because the sign language has a different, like the Indian sign language, there are different sign languages are already there. So it is not something which is solve 100% of the barriers. So that we completely agree. But in as the minimum standards in any communication, I think we really encourage the Indian Sign Language in many forums which we are using. And definitely the additional information, additional communication would help them. I do completely agree. And maybe Dr. Dominic can give better. Yeah.
I fully agree that when we talk of inclusion, we have got to look at what is the best local method of communicating to persons with disability, irrespective of the disability that they have, whether it is visually, hearing, intelligence, or locomotor. Communication should be that. That is why in my presentation I said the planning should be bottom up also, because if you know that an area is prone to a particular disaster, flooding, etc., then data before that is required and disaggregated data is required, so you will know in what method of communication is required to reach out to everyone in that community.
Thank you. I see that Ms. Neha Matthew has raised her hand. Would you like to unmute yourself and share your thoughts? There's a question in the chat on what are some of the roles that NGOs and other CSRs can do in ensuring inclusivity in their daily activities.
Maybe I could take that.
Sure, Ms. Namrata, go ahead.
When it comes to the role of CSOs and the corporates, most importantly, the awareness and sensitization is key on how to include people with disabilities. They could work in collaboration with the government and other people with disabilities and work on these elements to inform people about how to include and into considering the requirement of people with disabilities. Training of officials on who are the first responders is very important, as I mentioned earlier as well. And maybe Mr. Dominic or Ravi could add more.
Mr. Ravi, would you like to add something more?
Yeah, sure. I'm trying to just look at the chat box to see really that question I'm responding appropriately. So, in addition to the previous panelists, what I would like to mention, what is the role of NGOs is most importantly, the understanding the disability. What is disability? We really don't know. Many people don't know, including me. Some years back, I really don't. We understand very little about disability. And then we put a disability subject as a cross-cutting. Anything we are not expert, we put it gender is cross-cutting. Disability is a cross-cutting. And what is cross-cutting in humanitarian sector? In a very lighter note, like it may be like I see my program. I did some kind of tokenistic efforts and saying that it is inclusive. Like maybe a huge response I do. One person with locomotive disability got some relief work. I take his picture and somebody asked me, are you a program? Yes, I met one person in my response program across 50 village. We do emergency response, 1 or 2 images of the person with locomotive remaining. Forget about other disability. We often limit only with the locomotive disability. This is I'm not blaming anyone. It is just a matter of the understanding and the knowledge about disability inclusion is very bad. Actually, it is lack across NGOs, across CSOs, including this in the corporates. So what is most important in non-emergency situation, like for example, in CBM, we have a office and it is not, I wouldn't say that is the best office for inclusion, accessibility. But what happened, our building is not accessible. But our senior management, our board, our advisors, collectively we took some decision and we took some effort and make actually the venue, the office is accessible to everyone, whether the wheelchair person can come. Imagine we are running an office in Bangalore, the multi-story building. A person with locomotive disability sitting on the 3rd floor, and there is a fire or there is an earthquake tremor. What is the time actually required for a person to evacuate? It is only few minutes in your hand, but everybody can run. So in our office, we have a periodical mock drill, fire drill also. But what we realize that the person having a locomotive disability, they're unable to evacuate it on time because of our challenges. Then immediately we did a lot of research and consulted many people. And then we bought a evacuation chair. It is costed as 5 lakhs rupees. And so it may be an expensive one for 2 people or 3 people in our organization. But it is coming into inclusion practice is very important. But later what happened, the terrace is our multi-purpose place. People go for having lunch, some gatherings, some meetings, very evening meetings. Many people go, and again, there is no lift in the staircase, in the terrace. Then again, we did a lot of research, and then we found the chair lift actually. The chair lift, I don't know how many of you familiar. It is also very expensive. It's costed us about 10 to 12 lakhs rupees to make one floor with a chair lift. It goes in the handrail and then chair takes as a lift, it goes and take you. But what happened? These are the reasonable accommodation. You see in my office, many people having a larger screen. It may be 22-inch screen, computer screen, desktops. It helps people with low visual impairment who can really read well, and they can magnify it and read it. So many other examples which I can tell in ourselves, including the government. You see, the government of India has done an excellent program of Accessible India campaign. And then government has done a lot of NGOs become a empaneled auditor, and they do access audit of government building, the collector building, the collector office, most important, vital installation, the general hospitals or the court building. Many buildings were access audit done. Even CBM is one of the empaneled agency. We have done so many states, so many buildings was access audit done. And the recommendation has been given for government to make accessible and really person with disability access to everything. So giving, and in a nutshell, what I can do as an NGO, CSR, and other people. We need to bring the culture of inclusion in our workplace also. In an employee of more than 100 or 150 NGOs, staff member, how many are really person with disability? How many employees are visual impaired? How many employees are locomotive disability? Are these people given with assistive devices? The computer got a JAWS, whether the mobile phone got accessible features. Are they given really conducive environment for them to work effectively, comparing with the person without disability? I think this is the most important as culture of inclusion at the work spot, whether it's a NGO, government, or other CSR. We need to bring this collectively and we have to address it. So this is my point as a inclusion aspects to do that. Yeah.
Thank you, Mr. Ravi, on some practical examples on how we can make physical spaces more accessible. We have slightly exceeded our time, but maybe one final question we could have Ms. Neha Matthew. Yes, please go ahead.
Thank you so much, Michelle. I hope I'm audible. So yeah, this is me, Sneha, this side. I'm working in Sense International India. So basically we focus upon deaf blindness and children, like children and young adults with deaf blindness and multiple disabilities. So here I want to talk about is how there has been a paradigm shift, like from a traditional approach, replacing the traditional relief-centric approach to the holistic or the integrated approach that we are focusing upon, like prevention, mitigation, and preparedness. But over the period of time, when we talk about all these task forces, mock drills and all happening, do we seriously think like one of the main underground issues we see here is the data? We do not have a specific data, like it may be locally, may it be nationally. We do not have a specific data or the census of the number of people who are like disabled, like total into 21 disabilities. Like when we talk about deaf blindness, it's actually like they have visual impairments, they're hearing. So altogether, it's a multitude of problems they'd be facing. So currently taking about like during the COVID itself, we have seen how the bud schools had closed up and these children were pushed backwards. So there were multitude of problems had been coming up. So when we talk about establishing task forces or bringing up mock drills and institution, everything, I just wanted to ask, do we specifically have any institution that actually provides mock drills for such kind of people so that we can actually become it inclusive? And one thing I wanted to mention was Shruti is one of my colleagues. So as Ravi sir was rightly saying right now, how the NGOs have been inclusive, like the culture of inclusiveness in NGO. So Shruti is a deafblind person, but then she's commendable at her workplace. So what she has been doing is really, so I guess she's one of those people who would help us. But then what we need here is right now is how we can include other organizations to take this forward. So if there's anyone here in the panel or anyone who would like to help us with the same, that would be grateful. Thank you.
Would any of the panelists like to address Ms. Neha's comments? Ms. Namrata, are you still with us? Dr. Dominic, maybe on the technical aspects of what Ms. Sneha has suggested, would you like to add some comments?
Okay. Offhand, I can't think of an organization that would be able to conduct a mock drill for you, but I mean, we can look at making inquiries into how we can help keep in mind what requires to be done and work with you on trying to find solutions to it, and at the same time making sure that the solutions found are put in place for disaster preparedness in planning and policy at different levels.
Thank you, Dr. Dominic. As you also earlier highlighted, collaborations are key for ensuring that we have plans in place and systems that are inclusive. And we have a lot of action points from today's discussion, including accessible shelters and early warning systems that are inclusive of different disabilities and are accessible to them. We will follow up on some of these action points with the panelists as well as our participants. So we would not like to end this as a one-off event, but a series of events that we can collaborate on further to ensure that we find essential solutions to these problems, as well as a way forward on how to be more inclusive in our disaster risk management practices. This has been a very fruitful session for us, and we have lots to ponder about. And thank you to all our panelists and all our participants who have actively been part of the discussion in the chat box and otherwise. We are sorry that the ISL interpreter could not attend the session due to technical difficulties. However, yeah, we hope we have made a start with this session and we can follow up. And I would like to hand it over to Hannah for vote of thanks and next steps.
Thank you so much, Michelle. Hello, everybody. The discussion that took place today was very insightful, and we hope that the knowledge gained will prove valuable in the future for all of us. During the event, we heard about the importance of inclusivity in disaster management, the challenges that we face, the policy initiatives, and also about a lot of recommendations. With so many representatives from CSOs and NGOs in today's webinar in attendance, we hope that this message of disaster inclusion was clearly passed on, and it's heartening to know that we can all take a conscious effort in implementing this critical aspect, and I hope we all really do. We definitely acknowledge that there is a long way to go for all of us to reach full inclusivity. In that note, we also once again apologize for the inconvenience caused by the unfortunate absence of the ISL interpreter, and we would like to offer our assistance to anyone who faced difficulties. Please do not hesitate to reach out to us, and we will do our best to make up for any shortcomings. Moving on to the vote of thanks. On behalf of our organizers, I would like to extend my sincere thank you to all of you for participating in our webinar. We hope that the insight shared by esteemed speakers, Ms. Namrata, Mr. Ravi, Mr. Dominic, was thought-provoking, and you all speakers, you all shared your expertise, and it was very informative. And we would like to extend a heartfelt thank you to all of you for spending your valuable time for this event. Your extensive knowledge and experience in this field of inclusive disaster management, your practical field level experience, your personal experience, it provided a very valuable insight, and also it gave us ideas on how we can work towards in achieving effective disaster resilience, and by considering the needs of all. We would like to thank you all for your time, all the panelists, and also I'd like to extend thank you to our moderator, Ms. Michelle, for skillfully guiding the discussion and also ensuring it's timely completed. Finally, I would like to thank our CBM, our collaborator, CBM India Trust, for their guidance, cooperation, and continuous support in making this webinar possible. We hope that the knowledge and insight gained from this webinar will help us in work towards resilience and an inclusive disaster management actions. Thank you once again for your participation, and we look forward for your continued engagement in the future events. Lastly, I would like to thank all the participants who joined the sessions. We had an overwhelming participation today, and we hope that we all take the message that we received from this webinar forward in our workplace, in our daily activities, whichever sector we are coming from. So by that, I would like to close the session. Thank you all once again. Before closing, I would like to inform Sphere India Academy conducts regular webinars on topics related to disaster management. And it's very multidisciplinary. We do conduct in every week. So our next upcoming session will be on 20th April, and it would be a panel discussion on decentralization versus localization. It would be a very interesting discussion for anybody who is interested. So we would like to thank you all once again. Thank you, speakers and participants.
Thank you. Thank you so much. Thank you, Team Spear. Thank you. Bye.
Thank you, everyone. Thank you so much.
Thank you.